Introduction. Supplements that can support kidney health. What if I told you that certain supplements, when used correctly, could slow the progression of kidney disease by up to 25%? I'm a doctor, a board-certified nephrologist, and obesity medicine specialist. In this evidence-based guide, we'll explore the top supplements for kidney disease, supported by studies from trusted journals. This is not about replacing medical care, but enhancing it, because the right supplement, used the right way, can make a significant difference. Supplements 1T replace medication or a kidney-friendly lifestyle, but they can be powerful tools in your care plan. Water-soluble vitamins. The foundation for dialysis, patients' B-complex vitamins, are crucial for energy, nerve function, and red blood cell production. In kidney disease, especially on dialysis, these vitamins are often lost or restricted. Up to 50% of CKD patients are deficient. Meanwhile, vitamin C, in moderate amounts, can reduce anemia medication needs by 30%. However, excess vitamin C can be dangerous, so dosage must be monitored. Water-soluble vitamins help correct deficiencies, improve energy, and reduce oxidative stress, especially important for dialysis patients. Vitamin D. The bone protector and hormone regulator kidney disease impairs the conversion of vitamin D into its active form. It's causing bone loss and hormonal imbalances. Supplementing with D2 or D3 can reduce parathyroid hormone levels by up to 40%, improve bone health, and reduce inflammation. A 2023 review confirmed vitamin D's benefits in managing CKD complications. Vitamin D helps prevent renal bone disease and may slow CKD progression through hormonal and immune support. Omega-3 fatty acids. Fighting inflammation and heart risk. Omega-3 south from fish oil reduce cholesterol by 26%, triglycerides by 22%, and oxidative stress by 90%. They protect blood vessels, reduce inflammation, and are associated with lower heart disease risk, critical for CKD patients, as heart disease is their #1 killer. Omega-3 south are powerful anti-inflammatory agents that support heart and kidney health in CKD patients. Probiotics and prebiotics. Gut-kidney axis support the gut, produces toxins like indoxyl sulfate that worsen kidney function. Specific probiotics reduce these toxins by 30%. Prebiotics like inulin feed these good bacteria. Together, these symbiotics reduce inflammation markers by up to 75%. A healthy gut can reduce kidney-damaging toxins and inflammation. Probiotics and prebiotics are key to this connection. Niacin. Phosphate control powerhouse in doses of 400 to 1,000 milligrams. Niacin can reduce phosphate levels by 20 to 30%. Lowering cardiovascular risk in CKD, it works through a different schedule than traditional phosphate binders and can complement other treatments. Side effects like flushing are manageable with slow titration. Niacin is a valuable tool for managing high phosphate levels and protecting blood vessels in kidney disease. Keto analogs. Protein without the waste. Keto analogs are nitrogen-free amino acid substitutes. They help patients on low-protein diets maintain nutrition and muscle mass without adding kidney stress. Studies show they may delay disease progression and even delay dialysis by 6 to 12 months. Keto analogs support nutrition while easing the kidneys. Workload. Desperately useful in moderate to advanced CKD, preserving muscle mass and nutritional status. CKD often causes muscle wasting and malnutrition. Strategic nutrition and supplementation can preserve lean body mass by 15 to 20%, reduce uremic symptoms by 30 to 40%, and delay dialysis. Supplements like niacin, calcium citrate, and inulin have unique roles here. Maintaining strength in nutrition can dramatically improve quality of life in disease. Outcomes in CKD. Calcium citrate. The kidney-friendly calcium compared to calcium carbonate. Calcium citrate has 30% better absorption, causes 25% less constipation, and is less likely to cause soft tissue calcification. It also reduces kidney stone risk by 35 to 50%. It's the superior calcium choice for kidney patients. Calcium citrate is the best form of calcium for CKD patients, safer, gentler, and more effective. Inulin. A fiber that protects the kidneys. Inulin, a prebiotic fiber, boosts beneficial gut bacteria by 40 to 60%. reduces uremic toxins by 15 to 25%, and improves mineral absorption. This makes it a powerful ally for gut health, which in turn supports kidney health. Inulin improves gut balance, reduces kidney toxins, and supports mineral absorption, key for CKD management. Antioxidants. Neutralizing kidney damage, oxidative stress speeds up kidney damage. Antioxidants like alpha-lipo acid boosts antioxidant defenses by 50%. CoQ10 improves mitochondrial function and reduces stress markers by 30 to 40%. Unacetylcysteine lowers inflammation and proteinuria by up to 30%. Also helpful are acetyl L-carnitine for fatigue and turmeric for inflammation. Antioxidants fight free radical damage and can slow kidney disease progression when used properly. Creatine, the new frontier in dialysis, support long-feared in kidney disease. Creatine is showing new promise for dialysis patients, increases muscle mass and energy, reduces muscle cramps by 60%. May address fatigue and cognitive decline. New studies suggest that creatine loss during dialysis may make supplementation beneficial, especially under a doctor's guidance. Creatine is emerging as a safe, effective option for hemodialysis patients to fight weakness, fatigue, and cramps. How to use these supplements wisely? Always consult your nephrologist. Base supplements on lab results. Monitor for side effects or interactions. Prioritize well-studied supplements. Be cautious with newer strategies, like creatine personalization, is key. What helps one patient may not suit another. Informed guidance ensures safe and effective use. Summary. Supplements that support kidney health. Here's what we've covered. B vitamins and vitamin C. Restore energy. Reduce oxidative stress. Vitamin D. Prevents bone loss and inflammation. Omega-3 South. Reduce heart and kidney risks. Probiotics and prebiotics. Improve gut health and reduce toxins. Niacin manages phosphate effectively. Keto analogs. Support protein needs without burdening kidneys. Calcium citrate and inulin. Boost mineral absorption. Reduce stones, antioxidants, and creatine. Combat stress, fatigue, and muscle loss. Final conclusion. When used thoughtfully and under medical supervision, supplements can complement your kidney treatment, improve quality of life, and potentially delay disease progression. If this guide was helpful, hit like and subscribe for more evidence-based kidney health tips. Visit selfprinciple.org for downloadable resources, and share your supplement experience in the comments. Until next time, be kind to others, and especially to yourself.